In this video, you'll get a quick overview of Vibrant's tick-borne diseases test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. Lyme disease is a vector-borne illness primarily transmitted to humans through the bite of infected ticks. The disease is caused by the bacterium Borrelia burgdorferi and, less commonly, Borrelia mayonnae. Initial symptoms of Lyme disease often include fever, headache, fatigue, and the characteristic skin rash erythema migrans, also known as the bullseye rash. If left untreated, the infection can spread to the joints, heart, and nervous system, leading to more severe and chronic health problems. In 2022, over 63,000 cases of Lyme disease were reported to the CDC by state health departments and the District of Columbia. This number reflects cases reported through routine national surveillance, which is only one way public health officials track diseases. Recent estimates using other methods suggest that approximately 476,000 people may be diagnosed and treated for Lyme disease each year in the United States. Globally, it's been estimated that 14.5% of the worldwide population has been affected with Lyme disease at some point. Note that prevalence varies by region, with Central Europe reporting the highest rates at 20.7%, followed by Eastern Asia at 15.9%, and Western Europe at 13.5%. Vibrant's tick-borne diseases test evaluates for the presence of Lyme disease, tick-borne relapsing fever, tick-associated co-infections, as well as viral and other opportunistic infections. There are several panel options for tick-borne diseases. The Lyme plus tick-borne relapsing fever panel, which includes Borrelia burgdorferi and other Borrelia species. The co-infections 1 panel, which includes Babesia and Bartonella species. The co-infections 2 panel, which includes viruses like Coxsackie virus, Rickettsia, and West Nile virus. And the opportunistic infections panel, which includes Epstein-Barr virus, herpes simplex virus, human herpes virus, and streptococcal A. Vibrant's infections testing options handout outlines the specific species included on each profile and is available in your provider portal. And the tick-borne diseases markers list outlines both the antibodies and PCR analytes included in each panel. This is a screen capture taken of Vibrant's ordering page. You can order just Lyme plus tick-borne relapsing fever, just co-infections 1, just co-infections 2, and just opportunistic infections. Note that tick-borne diseases 1.0 includes both co-infections 1 and the Lyme plus TBRF panel. And the tick-borne diseases 2.0 is the most comprehensive and includes all 4 panels. Vibrant's tick-borne diseases test is a blood test that can be collected via venipuncture or dried blood spot. However, note that ordering via DBS does not allow for PCR testing. So, if you need evidence of DNA, be sure to order this test as a blood draw, not as a dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to the complementary tests. The tick-borne diseases test uses real-time PCR methodology for accurate identification of infection. RT-PCR is the gold standard for organism identification. Briefly, genetic material is extracted and purified from blood samples. Then, we pair microbe genes with known complementary sequences called primers to identify which infections are present. Primers are small fragments of single-stranded DNA or RNA designed to bind specifically to a single region in the microbe genome, allowing for precise amplification of the diagnostic target area. Then, we use probes to quantify the amount of each organism. The probes bind to the target area and give off a fluorescent signal as amplification of that area increases. This fluorescent signal is then read by the quantitative real-time PCR machine, where the reaction is occurring to give off a quantitative readout. The sensitivity and specificity of our primers and probes are quite accurate, ensuring high sensitivity and specificity. To measure antibody levels, Vibrant uses a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of 1 antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and then dice the wafers into tiny microchips. Then arrange the microchips, one for each antigen, in a 4x4 or 10x10 grid atop one pillar on a 96 or 24 pillar plate. Then the pillar plate is submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The tick-borne diseases sample report includes a cover page, introduction, summary with interpretation, and then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it says, "The Vibrant Tick-borne Immunochip test is a semi-quantitative assay that detects IgG and IgM antibodies in human serum/DBS for the tick-borne microorganisms with multiplex chemiluminescence immunoassay methodology." And the tick-borne PCR test is a real-time PCR assay based on probe-based qPCR and RT-PCR designed for qualitative detection of infectious group-specific DNA in clinical samples. As well as the part where it reads, "Reference ranges have been established using a cohort of 2,000 apparently healthy individuals," and goes on to explain, while the summary table provides a quick snapshot of the analytes tested, providers are encouraged to review the comments provided following the summary for a detailed description of the analytes and the tick-borne interpretation guideline available in the portal. Additionally, this is followed by a complete list of all analytes tested, including PCR results, IgG, and IgM titers for all organisms. Also note, for antibody results, the classification of green denotes a result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range, and the classification of red denotes a result that is elevated with respect to the normal reference range. The summary starts with a table showing all positive serology and PCR results, followed by interpretive comments for each marker that is outside of the reference range. And the full report lists the levels of all markers. If you order the Tickborne 2.0 as a blood draw, this includes PCR results for Lyme disease, tick-borne relapsing fever, Borrelia miyamotoi, and other Borrelia species, also babesiosis, Bartonella, HGA, HME, rickettsial disease, Powassan virus, tick-borne encephalitis, West Nile virus, Chlamydia pneumoniae, Coxsackie virus, Mycoplasma pneumoniae, Parvovirus B19, and Toxoplasma gondii, followed by all the antibody testing, starting with IgG and IgM levels to Borrelia burgdorferi, along with other Borrelia species including Borrelia mayonii, Borrelia afzelii, Borrelia garnii, Borrelia bavariensis, and Borrelia spielmanii. Then the tick-borne relapsing fever bacteria, including Borrelia hermsii and Borrelia turricati. Then Borrelia miyamotoi disease and other Borrelia species, followed by the parasite that causes babesiosis, including Babesia microti and Babesia dukkani. The next section is for Bartonella infection bacteria, including Bartonella henselae, Bartonella elizabethae, Bartonella visonii, and Bartonella quintana. Then human granulocytic anaplasmosis and human monocytic ehrlichiosis, followed by rickettsial disease, Powassan virus, tick-borne encephalitis, West Nile virus, Chlamydophila pneumoniae, Coxsackie virus, Mycoplasma pneumoniae, cytomegalovirus, then Epstein-Barr virus, parvovirus 19, Toxoplasma gondii, herpes simplex virus 1, herpes simplex virus 2, human herpes virus 6, human herpes virus 7, and finally, streptococcal A. Current and previous results populate side by side so you can compare the PCR results and the antibody levels over time. If you want to learn more about markers that are outside of the reference range, you can scroll back to the summary and read the interpretive comment. So, which patients benefit most from this test? Well, patients who've had a tick bite or live in a Lyme endemic area, patients with chronic fatigue, joint pain, or unexplained neurological issues, and patients with other Lyme-like symptoms including fever, chills, headache, appetite loss, anemia, weight loss, neck stiffness, muscle aches and pains, GI symptoms such as nausea, vomiting, and diarrhea, abdominal pain, enlarged and tender lymph nodes, dizziness or shortness of breath, numbness or weakness in the limbs, or change in cognitive or psychological status. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the tick-borne diseases test, consider the gut tumor test and Candida plus IBS profile for aid in identifying and addressing microbiome dysregulation. Or the wheat tumor, which offers an intestinal permeability panel that can aid in identifying leaky gut syndrome, which may be the result from extended antibiotic usage. Also, the mycotoxins test to help answer the question, is it Lyme, mycotoxins, or both? Numerous symptoms overlap between Lyme disease and mycotoxin-related illness. Additionally, it may be more challenging to resolve tick-borne disease when mold and mycotoxin illness is present. The Neurozoomer Plus is another test to consider since specific neurological antibodies have been studied to be associated with Lyme diseases, such as antitubulin, anti-NMDA, anti-neuron-specific enolase, anti-GM1, anti-dopamine receptor 1, and anti-dopamine receptor 2. Additionally, for late disseminated Lyme disease patients, consider the Lyme autoimmune panel, which identifies antigens known to trigger the autoimmune conditions Lyme arthritis, Lyme carditis, and Lyme neuroborreliosis, which helps to answer the question, is it active Lyme disease, or is Lyme autoimmunity causing symptoms in your patient? And finally, total immunoglobulins to evaluate baseline levels of total IgA, IgG, IgE, and IgM. Serology testing is based on normal functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is helpful for those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, Vibrant's tick-borne diseases test uses gold standard RT-PCR methodology and highly specific and sensitive microarray methodology to evaluate for the presence of Lyme disease, tick-borne relapsing fever, tick-associated co-infections, as well as viral and other opportunistic infections, helping guide in the management and monitoring of Lyme disease patients. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.